Before Alexander Fleming. Before Oxford laboratories. Before mass production lines. And Nobel Prizes. There was a kingdom in northeastern Africa called Nubia. In what is today Sudan and southern Egypt, along the banks of the Nile, archaeologists discovered something that challenged our understanding of history. When they examined the bones of ancient Nubians who had lived between 350 and 550 AD and placed those bones under ultraviolet light, the skeletons glowed. That yellow-green fluorescence was the unmistakable signature of tetracycline, an antibiotic that the modern world would not officially discover until 1948. The Nubians had been consuming it through their beer consistently and from childhood, nearly 2,000 years before we gave it a name.
Inside my veins, the same silt on my bones remains.
The story of how the world came to understand what those ancient Africans already knew is one of the greatest accidents in the history of science. To understand what penicillin gave the world, you first have to understand what the world looked like without it. For the vast majority of human history, a cut could kill you. Not the cut itself, but what came after. Infection. The invisible enemy that crept into a wound and turned a scratch into a death sentence. A scraped knee, a difficult childbirth, a pulled tooth, a soldier's bullet wound. In the First World War, countless soldiers survived their wounds only to die from infection. Field surgeons had almost nothing to offer. Surgeries were performed in filthy conditions. Gangrene spread through hospitals. Men survived the battlefield only to die days later in a cot, feverish and rotting. And it wasn't just war. Tuberculosis, pneumonia, scarlet fever, meningitis, diphtheria. These were not rare tragedies. They were the constant backdrop of daily life. Parents buried children from infections we now cure with a 3-day course of pills. Hospitals were places where infection claimed countless lives. Humanity had lived with this reality since the beginning of recorded time, and yet, not entirely without answers. In ancient Egypt, healers described in the Ebers Papyrus, one of the world's oldest medical documents dating to around 1500 BC, the practice of pressing moldy bread against infected wounds. Across Africa and beyond, in Greece and China, the same empirical discovery kept emerging independently in civilization after civilization. That something in the rot of bread and grain could stop wounds from turning fatal. These healers didn't know about bacteria. They couldn't have. But they observed with extraordinary precision what worked. And those ancient Nubians, whose bones glowed with tetracycline under ultraviolet light, 17 centuries after their deaths, may have been the most sophisticated of all. Chemical analysis published in the American Journal of Physical Anthropology confirmed the antibiotic was not contamination. It was in their bones, because it was in their beer. They were dosing their entire population, including children from the age of 2, in what researchers now believe was a deliberate, generationally passed tradition of antibiotic fermentation. As anthropologist George Armalagos, who led the research, put it,
"It's becoming increasingly clear that this prehistoric population was using empirical evidence to develop therapeutic agents. I have no doubt that they knew what they were doing."
The knowledge was there. What humanity still lacked for centuries more was the science to understand why it worked. In September 1928, a Scottish bacteriologist named Alexander Fleming returned from a summer holiday at his family home in Suffolk. He was 47 years old, unassuming, methodical, known in the scientific community for solid, if unspectacular, research on bacteria. He had served as a military physician during the First World War, and what he had witnessed in those field hospitals, men dying from infections that no medicine could touch, had never left him. Before leaving for his holiday, Fleming had left several petri dishes of Staphylococcus bacteria, the bacteria responsible for boils, abscesses, and blood poisoning, on a bench in the corner of his laboratory at St. Mary's Hospital in London. When he returned, most were unremarkable, but one was not. One dish had been contaminated by a spore of mold, most likely carried into the laboratory from a colleague's fungal cultures downstairs. In the ordinary course of science, a contaminated dish is a ruined experiment. You throw it away. You start again. Fleming almost did exactly that, but something made him stop. He looked more closely. Around the patch of blue-green mold, the bacteria were dead. A clear ring of destroyed staphylococci surrounded the contamination, like a moat. Fleming is said to have muttered, "That's funny." 2 words that would save hundreds of millions of lives. Instead of throwing the dish away, he grew the mold in pure culture. It was later identified as Penicillium rubens, formerly classified as P. notatum. Next came tests against bacteria after bacteria: scarlet fever, pneumonia, meningitis, diphtheria. The results were remarkable. Just as importantly, he tested whether it harmed the body's own cells. It did not. A rabbit and a mouse were injected. Both survived. In February 1929, he published his findings in the British Journal of Experimental Pathology. He named the active substance penicillin. The scientific community's response was almost complete indifference. For a decade, Fleming's paper sat largely forgotten. He could not purify the substance in any usable quantity. He sent samples of the mold to anyone who asked, hoping someone with more chemistry expertise might take it further. No one did. Penicillin waited. In 1938, 10 years after Fleming's discovery, a German-born biochemist at Oxford University named Ernst Chain was searching for a research project. He came across Fleming's forgotten 1929 paper while reading through the literature. He brought it to his supervisor, an Australian pathologist named Howard Florey. Together, Florey, Chain, and a young biochemist named Norman Heatley began the painstaking, grinding work that Fleming had never been able to do: extracting, purifying, and stabilizing penicillin. The challenge was immense. Penicillin was extraordinarily unstable. It degraded almost as fast as it formed. Early in the process, thousands of liters of mold culture fluid were needed to produce enough pure penicillin to treat a single patient. Heatley, working with almost no equipment and almost no money, improvised solutions at every turn. Growing the mold in ceramic bedpans, building his own extraction apparatus from scavenged laboratory parts, measuring penicillin concentrations by methods he invented himself. On May 25, 1940, the Oxford team injected 8 mice with a lethal dose of streptococcal bacteria. 4 were given penicillin. 4 were not. By the next morning, the 4 untreated mice were dead. The 4 treated mice survived and remained healthy. Heatley wrote in his diary simply, "The controls were looking very sick, but the 2 treated mice?" He didn't need to say much. The first human patient was treated in January 1941. A police constable named Albert Alexander. He was dying from a catastrophic infection that had spread from a scratch caused by a rose thorn. He had abscesses in his lungs, on his face, and behind one eye. Within 24 hours of his first penicillin injection, the improvement was miraculous. The infection was retreating. The man was recovering. Then, the penicillin ran out. They had so little that the team had been collecting Alexander's urine, extracting traces of penicillin from it, and re-injecting it. When even that source ran dry, Albert Alexander died. The medicine worked. Humanity just didn't have enough of it. Wartime Britain could not produce penicillin at scale. Factories were bombed. Resources were stretched. Drug companies were already manufacturing other wartime medicines. In June 1941, Florey and Heatley boarded a plane to America. Knowing that the precious mold culture could be lost or stolen during the journey, Heatley did something remarkable. He hid the mold spores inside his clothing. If their luggage was lost, the mold would survive on their bodies. They arrived in Peoria, Illinois, at the United States Department of Agriculture's Northern Regional Research Laboratory, a facility specializing in large-scale fermentation. There, American scientists made the breakthroughs that finally solved mass production.
First, they replaced Fleming's original nutrient medium with corn steep liquor, a waste product from Midwest cornstarch manufacturing that was available in staggering quantities. Yields increased exponentially. Then, in an act of pure serendipity that would have delighted Fleming himself, a laboratory assistant named Mary Hunt returned from a trip to a local market in Peoria carrying a cantaloupe melon covered in golden mold. That mold, Penicillium chrysogenum, produced dramatically more penicillin than Fleming's original strain. It became the basis for every dose of penicillin manufactured from that moment forward. By 1943, American pharmaceutical companies were producing penicillin on an industrial scale. The price dropped from nearly priceless in 1940 to $20 a dose in mid-1943 to 55 cents by 1946. On the beaches of Normandy on D-Day, June 6, 1944, Allied soldiers fought with access to a medicine that could save them if they were wounded. The mortality rate from wound infections fell dramatically compared with the First World War. Penicillin helped make that possible. A dirty petri dish left on a bench in London had done that. In 1945, Alexander Fleming, Howard Florey, and Ernst Chain shared the Nobel Prize in Physiology or Medicine. Fleming, characteristically modest, said at his Nobel lecture,
"When I woke up just after dawn on September 28, 1928, I certainly didn't plan to revolutionize all medicine by discovering the world's first widely successful antibiotic or bacteria killer. But I suppose that was exactly what I did."
The story of penicillin is not really one story. It is thousands of years of human observation, from the healers of the Nile Valley to the Nubians, to Chinese physicians, to European folk healers. Different civilizations, different centuries, the same pursuit. Fleming did not begin that story, he made it. As he later put it himself, "I did not invent penicillin. Nature did that. I only discovered it by accident." But accidents alone do not change history. People do. People willing to notice what others overlook. If this episode made you look differently at a piece of moldy bread, that was entirely the point. Subscribe to Chronicles of Innovation and hit the notification bell, because next time, we're going back to the workshop, back to the factory floor, to tell the story of an invention so simple, so overlooked, so utterly ordinary in appearance that it took 50 years to perfect. And when it finally worked, it quietly reorganized the global economy. That story is next.